Good morning, everyone. My study is on safety and efficacy of subconjunctival and subtenon block in manual small incision cataract surgery. No financial interest. Among various blocks available for cataract surgery, commonly used are peribulbar, which is the norm for the majority, is blind and invasive and can cause potentially dangerous side effects. Subtenon, which is less invasive but more comfortable to the patient. Third is subconjunctival, which is further less invasive and simpler to administer. It was an interventional randomized control trial having sample size of 196 eyes, 98 in each group, over a period of 18 months in a tertiary healthcare center of central India. Patients with cataract of any grade with no history of ocular pathology and surgery having aged more than 50 years were included in the study. Patients having additional ocular comorbidity, complicated cataract, sensitive to lignocaine, one-eyed patients and deaf and dumb patients were excluded. Pre-operative assessment of best corrected visual acuity, slit lamp examination, intraocular pressure, retinal evaluation, keratometry and A-scan and IOL power collection was done. All the patients were instilled with 0.5% topical proparacaine and 2% lignocaine jelly prior, randomized into two groups, subconjunctival and subtenon. At any point during the surgery, when the surgeon felt that the anesthesia was inadequate, he was allowed to give the intracameral anesthesia. The outcomes measured were pain, subjective assessment of pain on visual pain score analog while giving the block intraoperatively and postoperatively. Other outcomes were eye movements, which was graded into none to slight or moderate to excessive, patient satisfaction, satisfied or not satisfied, doctor satisfaction, satisfied or not satisfied, and intraoperative complications such as subconjunctival hemorrhage and chemosis, and others if any. The study was age and sex matched. The mean age in group 1 was 66 years and the group 2 was 64 years. Majority of the patients were having immature cataract in both the groups. Mean duration of surgery was 10 minutes in group 1 and 9 minutes in group 2, which was statistically insignificant. Mean vision post-operatively was 0.30 on day 1. 100% of the patients experienced no to mild pain in both the groups. 90% patients in group 1 and 93% patients in group 2 experienced no to mild pain during the surgery. Only 10 cases of group 1 and 7 cases in group 2 required additional intracameral block to complete the surgery. Post-operatively, 8 cases in group 1 and 10 cases in group 2 had to be given tablet diclofenac once as there was severe pain post-operatively. Others patient had no complaints. 89% in group 1 and 90% in group 2 patients were satisfied with overall experience of the surgery. In cases, 15% cases of group 1 and 10% of group 2, the doctor was not satisfied due to excessive extraocular movements and not cooperative patients. But in 85% of the group 1 and 90% of the group 2, the doctor was satisfied with the procedure and the block. In all the patients in group 1, moderate to excessive ocular movements were present. In only 11.22% patients of group 2 had moderate to excessive ocular movements, which was statistically significant. Half of the patients did not have subconjunctival hemorrhage and remaining which had mostly grade 1 or 2 and very few had grade 3. 60% of the patients of group 2 had no chemosis compared to 35% in group 1 being statistically significant. Others had grade 1 or 2 in both the groups. Comparing our study, the pain score is comparable with no to mild in all the patients. Considering doctor satisfaction, the study is comparable with 85 to 95% satisfaction of the doctor. Considering ocular movement in both the groups, the results were similar, showing no restriction of ocular movements in subconjunctival group. Most common complications associated with any block being subconjunctival hemorrhage and chemosis were invariably present in all the groups, but did not impose any difficulty while performing the surgery. Subconjunctival block can be employed as a minimally invasive and simple method to administer anesthesia safely for manual small incision cataract surgery. Most patients who undergo manual SICS under subconjunctival block perceive no or mild pain similar to subtenon. Surgeon discomfort is slightly more in subconjunctival but did not prevent successful completion of the surgery. Considering the intraoperative complication, both groups are safe with no major complication. Thank you.
What message? Hello?
Yes, sir.
What message do you want to give to the house with this presentation? Many persons are doing even topical SICS. So what do you want to suggest us to do?
Sir, but still the majority of the surgeons, like in our facility, I'm from GMCH Nagpur, so all
Do
my
you think
faculties.
that if you have to operate upon your father or your uncle, will you like to do this procedure? Do you think?
Sir, the study is on SICS, but
what
in
is
that
the
I would go
pain
for.
index in such cases?
Yes,
while
sir.
doing SICS in, I think the only skilled surgeons who can perform
Yes, sir.
surgery in a very short span of time
Yes, sir,
can
that-
opt for such sort of anesthesia.
Sir, that is the only limitation because the surgery was performed by only a single surgeon. So this study,
Anyhow,
yeah, this conclusion cannot be extrapolated to the beginners or surgeons who are not completing the surgery in a shorter period of time.
Okay, thank you.
What did you learn during the surgery, during the procedure, during the entire course? Like how difficult was that? What were the challenges you had? Because a lot of things were subjective here.
Yes, sir.
So any challenges you faced?
Sir, during the cataract surgery,
No, not that. During the study.
yes, sir.
See, some studies, they take numbers from the machines.
Yes, sir.
Here, there are no numbers from the machines.
No, sir.
So what was the learning and what was the challenge? The bias part.
Sir, the operating surgeon, so if at all, like if the surgeon is skilled and in patients who are being operated under subconjunctival anesthesia, there is no restriction of ocular movements. So if the surgeon is skilled and he is able to perform that surgery under subconjunctival anesthesia,
Did you understand my question?
sir, it will favor the, it will be biased towards subconjunctival anesthesia if.
Okay, thank you.